Are you new to inflammatory bowel disease? In this segment, I'll explain what IBD is. I'll highlight the key differences between the two main types of IBD, which are Crohn's disease and ulcerative colitis. You'll learn how prevalent IBD is, and that you are not alone in this diagnosis. Then I will give you 3 simple steps to get you started out on the right track. Have you or someone you care about been diagnosed with inflammatory bowel disease, Crohn's disease, or ulcerative colitis? Do you feel stuck with no idea where to start? Do you feel overwhelmed with conflicting information? I have been exactly where you are. I am neither a doctor nor a nutritionist. I am a patient that was given a diagnosis, a few scary statistics, and thrown back into the world with no roadmap of how to navigate this life-changing event. The most important thing I want you to hear right now is that you are not alone. Today, I'm going to get you started with the most critical pieces of information so you can begin to learn about what has just been thrust upon you. I will share with you what I have learned along the way and what has worked for me so you can take this information back to your healthcare team and start a conversation about what is right for you and your unique needs. So you've been diagnosed with IBD. Now what? Now is the time to educate yourself on the most important aspects of how IBD can and will change your life, so you can begin to make the initial decisions of the first steps to take, which will impact your daily life. First, let's answer your most pressing question. What is IBD? IBD is an acronym for inflammatory bowel disease, which is a progressive, chronic inflammation of primarily the gastrointestinal tract, also referred to as the GI tract, or sometimes you may also hear the digestive system. Let's break that down into smaller parts and examine each one of them so that you can begin to understand what this really means for you. The gastrointestinal tract includes the mouth, the esophagus, stomach, small intestine, large intestine, and anal area. The disease causes inflamed tissue and ulcerations. In simple terms, ulcerations are ulcers, which are sores created by breaks in the intestinal membrane. IBD interferes with the body's ability to digest food, absorb nutrients, and eliminate waste in a healthy way, preventing proper absorption of nutrients in the food you have eaten. With this disease, your body's immune system overreacts and causes uncontrolled inflammation in response to the gut microflora, which are bacteria and other organisms from your diet and environment that live inside your intestines. Since the dysregulated inflammation stays turned on, this means that IBD is a progressive autoimmune disease, meaning it may get worse over time. And you should know that it will get worse as time goes by because the inflammation and ulcers remain until they are treated with medication or sometimes even surgery. This is why treatment is so important, so that it won't get worse. Since this is an autoimmune disease, you're now immunocompromised, meaning that your immune system is having a harder time fending off infections, injuries, and even the common cold. When your body does have to fight off an infection or injury, it will take much longer for it to heal. IBD will continue to deteriorate your health if it is left untreated. If you're new to the world of being immunocompromised, for more detailed information, check out my upcoming segment on what does being immunocompromised mean. I'll put the link down below in the description section once that segment has been completed. So be sure to check back because this is an important part of the IBD diagnosis. Okay, so chronic means IBD is a persistent illness over an extended period of time. Technically, chronic means that it refers to a condition that lasts 3 months or more. But the cold, hard fact is that because IBD is an autoimmune disease, you will have this disease throughout the rest of your life. Unless and until scientific breakthroughs in the future can change this, IBD is not something that you can completely recover from or something that will eventually go away. Sit with that for a minute. This is a big deal, and it is not something that should be quickly glossed over. With the best case scenario, the disease can go into remission. where you do not experience symptoms. However, it is important to call out that from now on, you will experience the ups and downs of active disease, with flares of symptoms from new damage occurring, ranging from mild to debilitating, to remission when the disease becomes dormant, and then back to flares again. It is a repeating cycle where the time frame for each phase is currently unknowable. I recognize I have just given you a lot of information that is difficult to hear, and that must be really tough for you. I know that it was for me. But do not despair. Stay with me in this segment, and I will shine the light on the areas that contain hope for you and your future. Remember, each person's experience of IBD is different. Some people have such mild symptoms that they hardly even notice them, while others can have debilitating and even life-threatening complications that need immediate medical attention. Even in your own experience, there'll be good days and terrible days. My intention with this series is to provide you with as much information as I can so that you will not be surprised by something no one told you about. And more importantly, so you have the agency to make your own informed decisions about your body. Adopt what you learn here, or reject it. You get to decide. Hopefully, you will learn some valuable information along the way that by making a simple change here or there, your quality of life gets better. In a perfect world, your symptoms would become milder and your remission times would last longer. But nothing is guaranteed. Every person's journey is different, but I believe that information is the starting point for something better, and I want to help. IBD is an umbrella disease for the two primary types that are similar but show up differently and most often the GI tract. One is called Crohn's disease, and the other is referred to as ulcerative colitis. Now let's take a look at some of the key differences between them. At a high level, the main differences between Crohn's disease and ulcerative colitis are this. Crohn's disease is a chronic inflammatory disorder of the GI tract. It is most commonly found in the terminal ileum, which is located at the end of the small intestine, and is also typically located at the start of the colon. However, it can infect the entire GI tract from the mouth to the anal area. It is often found in patches of diseased lining next to healthy lining, a patchwork of sporadic ulcerations, sometimes referred to as skip lesions. Now let's check out the histology, which means the study of tissues and cells under a microscope. For the histology of the lining of the bowel wall, we find that Crohn's affects the entire lining of the intestinal wall through all the layers. In other words, ulcers can go through the whole bowel wall, creating a fistula, which is an abnormal passage or opening between two organs or between an organ and the body's surface. Unlike Crohn's disease, ulcerative colitis is a chronic inflammatory disorder of the colon, where the word colitis means inflammation of the colon. It affects the colon and the rectum, where it tends to start in the rectum and ulcerations migrate in a continuous way throughout the colon. Ulcerative colitis can affect the entire colon. A key difference here is that the ulcerations are continuous. From start to finish of the ulcerations, there are no healthy sections of tissue. For the histology of the lining from the bowel wall, we find that ulcerative colitis only affects the inner lining of the intestinal wall. This is the first two layers called the mucosa and the submucosa. There are also other differences between Crohn's and ulcerative colitis in symptoms, risk factors, testing methodologies for initial diagnosis and monitoring of the progression of the disease, treatments, complications, and so forth. All these elements are important to understand. Because of that, we have worked on more detailed content in other segments so you can be better informed. Now that you understand the basics of what IBD is and a few of the differences between Crohn's disease and ulcerative colitis, let's move on to put this into perspective. To put this into context, if we extrapolate to the 2020 United States Census, an estimated 2.39 million Americans are diagnosed with IBD. This means that nearly 1 in 100 Americans have IBD. Canada also has one of the highest rates of IBD in the world, with 1 in 140 people. Crohn's affects both males and females, but is typically more prevalent in females than in males, whereas ulcerative colitis is diagnosed for both males and females equally. What this highlights is that you are not alone. I bet that there are people in your life right now that have IBD without you even knowing. Whether they divulge that information to you or not, you have a community right here. Some people are starting out on day 1 of their diagnosis, today. Others are trying to figure out what to eat and what makes their symptoms worse. Some are facing surgery for the first time and can often feel unprepared and scared. Then there are those people that have been living with this for years who want to share what they have learned along the way. You, my friends, are not alone. So now let's give you some simple steps to get you started out on the right track. Step 1. First and foremost, learn about the disease you are diagnosed with. Learn what it is, how it impacts your body, what it means to be immunocompromised, what the symptoms are, what the complications can be, what the risk factors are, what tests could be ordered for you, and what lesser-known aspects are that generally do not get talked about. If that just made you panic a little bit, don't worry. I plan to help you out with all of these topics. Step number 2. Second, you should work with your healthcare team with the goal to slow the progression of the disease and help manage your symptoms. The lead physician for your IBD will be your gastroenterologist. Other supporting members of your healthcare team will depend on your unique needs, which can change over time. Step number 3. Third, learn everything you can about nutrition and how it impacts IBD. Begin to understand both what makes flares worse and which food items reduce inflammation. Most critically, learn which ones can start to help heal affected areas of your GI tract. Don't worry. As of today, I have over 400 pages of research that I have collected for this very purpose. Over time, I intend to ensure that you get access to the most important content so that you have what you need. I imagine that a new diagnosis of IBD could be pretty frightening for you. I know that it was for me. The good news is that with a few lifestyle changes, you have the potential to have a positive quality of life. You might have to spend more time in doctor's offices getting more tests than you did before, making changes in your diet during flares, and making your overall health a priority. But all these things are now a part of your new normal, and how you will get there and where you want to be regarding your health. This is IBD Vegan. I'm your host, Alexis, and I want you to remember, it is possible to become more educated, resilient, and feel empowered for a better quality of life.